So we've called our presentation Getting the Balance Right. And this is a bit of a steal from a conference at the Royal College of Occupational Therapy that Marie Gascoigne and I presented on. And I think it fits a description of what we're going to talk about, because really what we're talking about is that distribution of your finite, valuable resource across a tiered model of service delivery to achieve the best possible outcomes for our people. So we're going to be talking about transformational collaboration and what that means for our populations. Everything amazing does start out as unrealistic, and one of the challenges of this, and I'm going to take you on that challenge ride, is that this is a way of working that requires faith, commitment, motivation, and at the heart of that, relationships, trust, and a willingness to take risks and try things differently. And that's basically what I'm going to talk to you about as we go through. So, health warning, this is not a quick fix. We're trying to tell you about 2.5+ years work in 20 minutes, which is my biggest challenge. We need to talk about what is required to actually transform how we make decisions, how we think about our people, and how we invite them to collaborate with us in establishing trusting relationships that enable them to achieve their best possible lived life experience. So this really required us to think about and understand, in the absence of meaningful data, how are we making decisions? Because when I ask heads of service to give me figures and data about their caseloads, their workload, their capacity, that usually takes a lot of paperwork and number crunching, and so we began to question what does that really tell us, and how are we making decisions about how we use resources if in the absence of that meaningful data. We had to understand that by keeping our knowledge and expertise at specialist level, Tier 3, we are actually failing our duty of care at both a population level for all of our people and at a targeted level for those people who are more at risk than people in the general population and have greater challenges. So it's incumbent upon us to think about how we get our expert specialist knowledge out to our people so that they can take hold of that knowledge to support their own well-being and establish self-resilience and self-reliance supported by us as experts. And critically, we have to challenge some of our most closely held beliefs about what makes a good service. And Rebecca talked about that. People's expectations about what a good service are usually mean escalating as fast as possible to Tier 3 for a one-to-one. And so we in Scotland are trying to bring our people with us to understand that actually we can support you to support yourselves and achieve really great well-being outcomes. That is one of the biggest challenges. And we're considering how to maximise our current resource across this tiered model of service organisation. And one of the biggest ones, valuing early intervention prevention in its truest sense, and to resource this robustly with our own workforce. And people talk about early intervention prevention in all of the policy across all of the nations. And really, this is a really tough place to be working, and it requires your most experienced, your most knowledgeable, your highest graded practitioners to be working in early intervention prevention at universal and targeted. And critically, if it's whole systems, your leaders and your influencers have to understand your direction of travel and support the principles, because the going's going to get tough, because people will resist, people will be sceptical, people will complain, and you have to be willing to have your leaders with you who are going to hold on. Oh God, I've got 5 minutes. I wanted to talk about Campbell Christie. Campbell Christie wrote a commission report on public sectors, public services, and he said we need urgent and sustained reform to meet unprecedented challenges. We need to embrace radical new collaborative culture through our public services, and we have to tackle the fundamental inequalities and focus resources on preventative measures. And this is what we are trying to do in Scotland. And what it meant is that we had to change the conversation at the point of referral. This is where you have the power to transform your service. Most services in the UK accept 98% of the referrals onto either waiting lists or, if you're lucky, direct into intervention. We are putting an end to that. We are asking the question, why have you asked for our request? We're putting the onus back on our referrers, and we're taking back responsibility for making the decisions about the point of referral at who needs us. Most people, 40 to 60% people could have their needs met through early intervention prevention. Most services can't explain who's waiting and for what, and we're getting rid of eligibility criteria and accept-reject processes that get in the way of people meeting their needs. We have to ask ourselves, who are these for? Are they for our people or are they for our services? And this is a really important one. And we're putting our decisions, as I said, back in the hands of our skilled practitioners, moving from problem-based decision-making to impact focus. So what does it take? As I said, most experienced practitioners making decisions at point of referral. This flies in the face of the perceived culture where you have admin staff making the first decision. That is a barrier to access. You need your most skilled decision makers making the decisions about how people can be helped. And having alternatives to assessment, to signpost, to reassure, to educate or to escalate. So this means that you need a whole system. You deal with your referral issues, but you also have to be resourcing your early intervention and prevention at the same time. Otherwise, your practitioners have nowhere else to signpost individuals. Redistribution of our workload from specialists to include capacity building upstream and outcomes-based pathways. So what we did, we started understanding our data and the impact of our demographic through work with the balanced system. We changed the conversation with children and young people and requesters at the point of referral to who's bothered with our work with Kate Malcolmus, and we were taking risks around our use of resources and shifting staff based on our understanding of population in need, and we were valuing early intervention and prevention and resourcing this. We're also accepting that our way of working, I'll speed up, Glen, our way of working wasn't working. We have to accept this. We've got enough evidence that we're not meeting the needs of our population through a refer, assess, treat model because of a whole range of variables, human and other, that impact. And I haven't got time to talk to you about this, but if you look at the adverse childhood experiences work that's happening and the direct correlation between the number of adverse experiences and all of the public health crises in our country, you'll understand why that isn't working. I've given you copies of these on your table. I don't have time to go into them, but I'm happy to speak to people at the break about this. But this is our public health intergenerational cycle. What happens to babies and children impacts on our adults' health and well-being in the long term. And we need to be putting in place opportunities to interrupt this cycle for our population. And on the back of that handout is our tiered model, which is based on the 5 pillars. So being in a tier 3 doesn't allow you to address family support and environment at a population level. And this is what some of the work that Glen's going to talk to you about. And I just finally wanted to share this last slide with you, just to show you what can happen when you can truly commit to a whole systems transformational journey. The purple block is waiting time, going from something like 36 weeks down to consistently 8 weeks. The blue line is the number of requests for help. We don't call them referral anymore in Scotland. And that's going up. The green line, starting from a baseline of 0, is the amount of early intervention, prevention, education and learning and group opportunities for our community going up. And the red line is the number of children and young people needing in specialist assessment and intervention. And as you'll see, although correlation and causation are not the same thing, what we're seeing consistently across Scotland, that as we increase the opportunities in people's communities, so their reliance on us at a tier 3 reduces. So you can't unknow what you know, and so we are committed to replicating this work across Scotland. And there's lots of really brilliant work happening across Scotland, and I'm very grateful to Glen Carter for coming to share with you what this looks like in practice in his area of Scotland. Come on up, Glen.
Good morning, everyone. It's great to be here. I'm ashamed to say this is my first time in Wales, but I've had a great experience so far, including a very friendly bus driver last night. So I've got a couple of jobs. My first job is to follow Pauline, which is never an easy task. My second job is to try and explain how some of these principles have been translated to our service. Scotland is an exciting place to work at the moment. It feels like over the past 4 or 5 years that speech and language therapists and HPs are facing an open door rather than constantly running into a 10-foot high wall, which it used to feel like, where we're trying to explain why communication is important and explain the implications of not addressing it. And when I was trying to reflect on this, I think that's because we haven't purely taken an approach just from a speech and language therapist perspective, but we've worked really closely with our key stakeholders to come up with solutions together. And I think that's really important because these solutions are complex, and we need to try and address improving outcomes for real people in real situations. So I'm just going to pick up on a few points of what Pauline has mentioned. And when I look at Forth Valley over the last few years, I'm seeing that we are more person-centred. We're seeing that we're reaching more children in poverty, and that we are having positive outcomes for children. And that shift is, we've made that shift by implementing some of the things that Pauline has mentioned, namely understanding the system and data, redistributing the resource, being brave about that, and changing the conversation, but also taking a whole systems approach to this and improvement. So first up, understanding the systems and data. We were part of one of the pilot sites where Pauline facilitated us to work with Marie Gascoigne on the Understand of the Balanced System. I'm sure you've heard of it. We basically gave ourselves permission to stop, to understand what we were doing, and to reflect on, are we going in the right direction? Are we meeting the needs of our local population? And the process allowed us to understand our prevalence, our deprivation, and our predicted speech-language communication needs. And we used some of that. The slide doesn't properly reflect it, but we used some of that to try and demonstrate to our key stakeholders the level of need. And that was what was within Falkirk at that point in time. We also used the mapping tool in the balanced system. This was one area in Forth Valley, Clackmannanshire, which is one of the highest areas of deprivation in Scotland. And we reflected on what provisions do we have in place across the 5 strands and the 3 levels. And you'll see that at that point in time, that's changed significantly since then. The darker area shows fewer provisions, so along universal and targeted, and more along the specialist level. So the senior team reflected that actually the level of need was much higher in this area, and we needed to think differently about that. We started having conversations about what we're going to do about that resource. It just so happened at that time, excuse me, the Scottish Government invested very heavily in Clackmannanshire and gave additional resources to education at that point, and they used some of that resource to facilitate us building our universal and targeted offer in that area. So we used some of this learning to be able to come to our key stakeholders, namely education, to say this is what our model is, what we're trying to achieve from within the core funding. We very clearly said to them that model shouldn't be static, it should be dynamic, it should be influenced by innovation, it should be influenced by research, but these are the things we're trying to achieve across those 5 strands and 3 levels. So what next? What about changing the conversation? So Pauline mentioned about changing the conversation. What I'm going to do right now is try and reflect my shift in thinking and then how that translated to the service. So I don't know if you're like me, but when I came out of university, this is what I was thinking. If it's important to me as a specialist, it should be important to you. So I was clearly functioning within an expert mindset, and I had to challenge myself on that. Also, another thing that helped me shift my thinking to be more person-centered was the question was, is my work making a difference in the child's life? I did a lot of work within education. I began to see it wasn't just all about the impairment, it was about whether the child could participate, what their day-to-day life was like, and their well-being. And then another question, is this work important to the child or family, their priorities? Did I actually ask them properly what their priorities were? And was I asking the right questions, and was I listening? And then laterally, am I the right person to do this? Can I affect change, or do I need the help of someone else? Quite often there's countless families who won't come near professionals. If they do, they won't listen to them and don't trust them. So who is it around the family who has the relationship to be able to bridge that gap? And then this idea of perceived power. So working from expert to enabler. So in order to become person-centered, I think we need to be willing to be able to give away power, or perceive power as I've articulated it there. Because by doing this, if you actually get it right, you manage to become more influential and have a bigger impact than if you don't. So of course we need our expertise, but we need to be willing to move into the messy zone of families' lives, to get in amongst it and to work out what they are wanting and what's going to affect change for them. And I think this concept of giving away power is extremely significant for therapists working with families directly, for therapists working with people who are closest to that person or family to try and enable change, but also for leaders. And when I see the most effective therapists and leaders, they're the people who've managed to be brave, to give away power, and in a supportive and safe way, but they acknowledge that we need to be able to deal with complexities of real life, and we can't do that on our own. So this is how we're trying to ensure that we're person-centered. The visual represents how the service shifted and the service drove this. Initially, it seemed to be like the families had to go in and out of doors to be able to find the right professional. Sometimes those doors were locked. Sometimes they didn't have the capacity to get through all those doors. And the referrer quite literally would hand over the problem to someone. I spoke to a parent recently who came across a professional and said, I don't treat children with autism spectrum disorder, I just diagnose them. Speech and language therapists treat that. So that was handed straight over to us. The parent felt, you're the one who's going to fix this situation, and you're the only people who are involved with that. We don't use accept and reject anymore. Our philosophy is that every concern is valid, and I'll speak about that in a minute. We accept all of the requests, but we don't necessarily move to investigation or intervention. So now what we're trying to do is to have a conversation with every requester. We're not quite there yet. We show the person that their concern is valid and that they are important. I spoke to a mum recently who was a very empowered, able mum, and she told me her story about a series of disempowering engagements with health staff. And her child was quite unwell for the first 2 years. She needed invasive, intrusive medical intervention. But following that, what she described to me was a series of interactions, many assessments, interventions where the lack of discussion, consultation, and choice was staggering. She now has a child who will have tantrums and will get very upset when they come anywhere near a health setting, and yet she's still been asked to come to those settings. What she described to me was a desire to be part of it. She said, if I've got all these resources at my fingertips and I can't manage it, what about other families? So more recently, she had an interaction with a professional who, before she knew it, there was a request for assistance for speech and language therapy, and that's why I was having this conversation to her. And I said to her, what will happen is that if you want the request to continue, we will have a conversation with you first. We will not jump straight to assessment. We might ask questions like, what's your biggest concern? When's your child is their happiest? Is there anything else you'd like us to do that you'd like to do that you can't at present? And what have you already tried? And then we can then move to, it doesn't have to necessarily go to assessment. It could be reassurance, investigation, signposting, etc. This is the first 8 months of 2018, 74.9%. This is out of 463 requests. Basically 75% moved to investigation. We're hoping over time, as we grow the other offers and the quality of them improve, that not as many of those people will have to go straight to assessment. You'll see some went straight to intervention and some went through other means. We are trying to build that resource, and that is a work in progress. So, This is the child at the centre. You'll see the people closest to them right on the outside, right in the middle, then the universal services, and you'll see allied health professionals towards the outside. Now, those allied health professionals need to get closer or move away at times, but sometimes when families are in complete chaos, they're living in poverty, they will not, if they do get near a professional, they don't trust us, and they will not listen to what we say. If they do listen to what we say, quite often they don't have the capacity to do anything about it. So laterally, I've been thinking, right, who is it that they trust? Is it a family support worker? Is it an early years officer who can either bridge the gap between us and them, or can indeed give some of the key messages that we're trying to get across? So we use lots of data to try and demonstrate outcomes, which I don't have time to go into. So lastly, Talk for Authority is our approach, the universal and targeted approach. It stands for talking and learning with our kids. And we've got a whole nursery approach called LIFT, Languages Fun Together. We've got a whole school approach called FOCAL, which is focusing on communication and learning. And if you were to look at the DNA of those approaches, you would see that they are based on true collaboration, based on real relationships, SLTs empowering others and learning from others, sustainability. We are reaching children in poverty, they are experiencing positive outcomes, and we're using a whole systems approach to change. I suppose and finally, the idea of giving away perceived power can feel disempowering at times, but it's our experience that is the exact opposite. By engaging the people in this way and keeping the families at the centre, we are finding that our reach and our impact as a profession has grown significantly. So in conclusion, the things that have helped are understanding our system, being brave in redistributing resource, changing the conversation, and making sure we're absolutely keeping families at the centre. Thank you.